being a therapist and being someone who helps people doesn't mean mistakes don't get made.
Yeah.
But what you and I have harped on, because we have a lot of conversations about this, is when you make a mistake or you have done wrong by someone unknowingly and knowingly, how do you clean that up?
Mental Health Monday.
Mental Health Monday.
Me, I am able to know that you are, an expert in your field and you're not going to steer me the wrong way, or you're open enough to make mistakes and I can accept that. But at the same time, I'm trusting you with my deepest, darkest secrets that you will help me, lead me along the right path, right? Safety is providing an environment that is safe for me to be my authentic, vulnerable self, and a place where I don't feel like I'm gonna be at harm, whether it be physically, mentally, or spiritually, in those spaces, whether that be virtually or in person. Repore is me building that therapeutic alliance with the client and the therapist to create a safe and healing place and process. So those three-pronged approaches, I think, are super important for therapy, in the therapy space, and I think it's super important, especially for us as Black men and Black women clients. And so those are my three-pronged for the two. And
could you repeat what the two was?
The two?
Yeah, for the folks.
Oh, for the second. So the second one with the three-pronged approach for the second priority, I think, is trust that your therapist should be establishing trust, safety, and rapport.
Okay.
Yeah. And third, even though the openness is kind of making the mistakes, but I'll say with the third one, that kind of extra one caught everybody. Openness, trust, safety, rapport, and I don't know.
I think if I were to interject and say with the third one, I'd say the third one is being willing to clean up your messes when a mess is made, but doing it correctly.
See, I was going there.
Yeah.
But I thought maybe...
I think people are afraid to say that.
Put it in the openness piece, right?
Being a therapist and being someone who helps people doesn't mean mistakes don't get made.
Yeah.
But what you and I have harped on, because we have a lot of conversations about this, is when you make a mistake or you have done wrong by someone unknowingly and knowingly, how do you clean that up? Most people define clean that up as it's no longer a problem. They're not going to talk about it publicly, so it's okay. And it's like, nah, but everything leads back to the relationship.
Yes.
Are you doing right by the relationship you've established with them? And do they understand and recognize your actions that you're trying to do right by what originally this was when it started?
And that can fall in the line of, so it's kind of mixed into the openness and the trust, safety, and rapport piece. Willingness to make mistakes, and like you said, willing to clean that up. What does that look like? Okay, well, if I feel like as a therapist in a session I made a mistake, or I said something out of the way, or I wasn't on my A game as something that's happening in session.
You had 23 clients instead of 16 clients, and that workload may have thrown you off.
Thrown me off.
Yeah.
I didn't take care of myself, or I just didn't communicate effectively, right? I should be able to talk with my client and tell them, hey, apologize about my tardiness, or apologize about my lack of effort, apologize for maybe saying this might have been offensive.
Or being less empathetic this session because of everything I had this week.
Apologize for being distracted, things like that, to enforce that so that you can say that in session. I also think there should be a nice environment where your client should be able to call you out on that.
Yeah.
Right? And it should be no repercussion, right? Your client can say, oh, yeah, you a little bit off today. You look tired today. They can say that, and it could be no detriment to what their treatment is being going forward because they said that.
Yeah.
So it should be no fear of retribution around that. And so I think that's just, so that piece is, willing to clean up their stuff in session and building that environment, because that's what we're here to do. We're here to do work.
Yeah.
So.
Would you say the culture of therapy, there's a culture of therapists who want to work with other therapists or learn from other therapists, and there's a culture that's what I learned through this book is what I do by the book, no matter the situation. Which is hard line. Like, they only follow the book, no matter like the real world experiences they see that are happening that you don't learn in a class. Because I don't think everybody adapts.
Well, that's the problem. That's the problem.
Tell me.
Because the books that we are taught and the interventions that we are used are evidence-based, but most of them are whitewashed, right? And so sometimes they're not inclusive to, black people or people of color, things like that. And so if you work long enough in the field, you understand that, things we were taught in the class usually does not equate to in the actual, in the field sometimes.
Yeah.
Things look different, right? What we see as a crisis by the textbook might not look like that in the hospital setting or in a community setting or aging setting. And so if you're not adapting and if you're not also, it's hard, I think, to do therapy without bringing that type of stuff in there because I don't think you can be effective. One of the things that I talked about, I had a training last week or so, talking about working with black men in therapy, and there's this big issue around making therapy political or making the room political in the session where it feel like, okay, there's no place for that. But how can you say that if that's part of that person's life and journey? So
or that may be a part of their issue.
Or that may be a part of the issue. That may be part of their anxiety. It may be part of their stress, their depression symptoms, things like that, because of they're feeling the weight of oppression and marginalization in the world due to the color of their skin. So to say that, okay, we're not going to talk about it in therapy, we're going to talk about these other symptoms, you're dismissing one part of the experience of that person. That's not fair.
Yeah.
That's not therapy. That's not therapy.
Yeah.
So, because we're here to work on these experiences, these these emotions, these moods, these traumas.
Sometimes
Shortcomings. We want to better ourselves. We want to learn how to navigate stress better. But if that's a source of my stress, who are you to say that this doesn't belong in therapy?
Yeah.